afternoon, everybody. I'm Craig.
And I'm Brittany.
And today we're going to be talking about frozen shoulder.
We're going to be telling you what it is, how to treat it, and some things that you can do at home.
But first, make sure you subscribe to our YouTube channel at Integrated Physical Therapy and click on that bell to make sure you receive notifications when new videos are released. Brittany, what is adhesive capsulitis?
Such a good question. So adhesive capsulitis is just the fancy term for frozen shoulder, and basically it's stiffness inside the shoulder joint capsule. So every joint in your body has a capsule that surrounds it, and specifically with frozen shoulder, you get very restricted movement in all directions that the shoulder moves. So reaching up, reaching behind the back, reaching out to the side, all of those things are going to be painful and super limited. It's really common in women, usually ages 40 to 60 is the most common. Doesn't mean that that's the only age group that it happens to. And also, unfortunately, the cause is kind of unknown, so it can come out of nowhere.
That's right. So the research has shown us that women 40 to 60 are most likely to develop frozen shoulder. It can come from anything from a major to a minor trauma. That could be walking in the dark at home and bumping your shoulder into a doorway, lifting your arm up and feeling a pinch or an impingement in the shoulder, and then within the next 2 or 3 weeks, all of a sudden we can't move our arms. And that's what we call frozen shoulder, or medically called adhesive capsulitis.
And with frozen shoulder, you're going to see a couple of different stages. So that first stage that Craig just talked about where you're very limited, that's your frozen phase. So that shoulder is stiff, stuck, not moving. Then as it starts to thaw out, then you're actually going to start to get a little bit more movement. Still going to be really difficult to do things like reach behind the back is usually one of the hardest things to get back. But as that shoulder capsule starts to loosen up with some manual therapy, some stretches that we're going to show you today, then you start to get that movement back.
And frozen shoulder is just a really easy thing to fix, right? It can be fixed in a week or two.
Definitely not. So it's one of the trickier things because it does take a really long time to heal. And it can take up to 6 months to a year for your shoulder to go fully back to that range that feels normal. Doesn't mean that you're going to be stuck here for a year, but really to feel like you're able to reach all the way up, all the way behind your back without any pain can take that long.
And it's true. So it's important to manage expectations. If you have a true frozen shoulder adhesive capsulitis, please have the understanding and the patience to know it's going to be a bit of a long road. No pain, no gain does not apply here. However, you will experience some discomfort if you push your range too far in the beginning. So like Brittany was just saying, we'll show you some tips to do when you're not in your therapy program, because if you keep in mind that there's 168 hours in a week, you come to therapy anywhere between 2 and 3 hours. The other time that you're not in the clinic is more important to make sure you're keeping up with the range of motion that you achieve with the manual work we're going to show you today. So Brittany, can you please tell us what structures are involved in frozen shoulder?
There's a lot of things that go into frozen shoulder. We talked about the capsule and how everything around that is going to get stiff.
Right.
So if you look on like an MRI or an image or something like that, what you'll see is what's normally kind of saggy, where there's space in the bottom of your shoulder capsule, is going to be restricted and tighter. So it's going to look like there's not as much space, which there isn't. And then on top of that, now because your shoulder's been in this stuck frozen position for so long, those muscles around it haven't moved in the way that they normally do. Every time you reach overhead, all your muscles are stretching, lengthening, doing all the things they need to do. Now you're saying stick in this straight jacket right here, all those muscles around it are going to get shorter. You're going to lose the stability in your shoulder because the muscles that support your shoulder blade and connect the shoulder blade to the thorax or that mid-body, things like your serratus and your lower trap, are also going to get weaker. Everything around it is going to tighten in the worst ways and weaken in the worst ways.
So we talk about the shoulders, what's called a ball and socket joint. That's a ball fitting into a socket. Not like the hip where the actual leg bone sits inside the socket of the hip. The shoulder is more like a golf ball on a golf tee. So the ball itself sits on top, or in this case sideways to the tee or the socket of the joint. The head of the arm bone, the humerus, is larger than the socket of the shoulder blade in which it fits into. So the structure, the ligaments, the muscles, everything holding it together, including the capsule, is really what maintains the structural integrity of that shoulder joint. So adhesive capsulitis or frozen shoulder is when that inferior or bottom part of the capsule becomes scar tissue down, restricting that range of motion. So when you try to lift your arm up, what's really happening is up in the shoulder, the bone actually rotates downward to create space. In this case, because of the restriction, it can't. So the bone rotates up and butts up into the bones on top, the acromion process, that creates tendonitis, impingement, and again, that's part of the frozen shoulder complex that we're going to be showing you how to work on today.
And I would say a lot of times people come in with the diagnosis of frozen shoulder, and it's really easy to misdiagnose, because if you have pain in your shoulder that's not associated with frozen shoulder, let's say it hurts when you lift your arm overhead, your go-to move is going to be something kind of funky like this when you try to get your arm up. Looks frozen, looks very restricted. Unfortunately, this medical model of a world, doctors only have 5 minutes to see you. You show them that and they say frozen shoulder. We're fortunate enough in the PT world to have a lot longer to spend with you. We can look at every movement, all the different directions, look at your strength, muscle test, and then decipher if it's actually frozen shoulder or if it's something like impingement.
And 2 different diagnoses there. Differential diagnosis, frozen shoulder, where there's an adhesive capsulitis, or what we call a adhesions or scar tissue that binds down the physical motion of the structures of the shoulder, whereas an impingement might be where the biceps tendon or part of the rotator cuff is being impinged between the arm bone and the collarbone and piece here, the acromion process. Impingement versus a frozen shoulder.
And you might have more than one thing going on at the same time.
Always.
Pretty easy way to kind of differentiate if it's muscular or capsular distinctly on their own would be pain when you're lifting your own arm overhead and it gets stuck. But then let's say you do something like a slide on a wall, or you have your friend move your arm with it very relaxed. If you're still getting stuck in the same place that you were when you're active,
right,
that's going to be more on your frozen shoulder side. If you're able to get higher when someone lifts your arm and it's not painful there, it's getting past that capsular restriction where it would be for frozen shoulder, that's going to be something that we're looking a little more muscle or tendon in nature.
And Brittany just made a wonderful point right there. I don't want to gloss over it. It's never one thing. You can have frozen shoulder with impingement. Oftentimes those go hand in hand. You can have impingement with inflammation. You can't have impingement without inflammation. A muscle tear can be part of impingement with inflammation. These all are pieces and parts of the whole puzzle that is so important to get to the root cause of.
Yeah, absolutely. So when we talk about treatment for frozen shoulder, we're going to talk about it in respect of it being the true diagnosis of frozen shoulder, but just things to look out for are going to be like those differences we talked about, being able to get yourself passively a little bit higher, noticing if there's certain muscle movements that cause more pain. Those things are stuff we want to look at in a separate video, but for today we're just going to focus on adhesive capsulitis as it is.
And we're always going to treat the whole body, the whole person, the whole system. The shoulder's connected into the neck connects into the spine travels down into the pelvis. So today, as Brittany just said, we're going to focus in on the treatment for specific frozen shoulder. When you come to us here at Integrated Physical Therapy, we're going to look at you as a whole person.
So what we're going to start off with is just super basic. We're going to try and get more range throughout that shoulder. And again, everybody's starting point is going to be a little different. So I've got Craig here, he's set up next to the table. Affected arm for him right now is going to be the right side, and he's resting it on the table. Okay, if your starting line, like let's say, what's your pain right now, 0 out of 10?
8.
Okay, so if you're at an 8, that's pretty high. That's probably as far as we're going to go. Okay, if you're starting a little lower than that, maybe more like on the 2 to 4.
4.
All right, then we're going to try and go up on the table. It's going to slide nice and slow. You're going to get to the point again, it's going to feel tight, it's going to be a little uncomfortable, but you don't want to go to that 10 out of 10 pain. You just want to stop when you feel that restriction, go nice and slow in and out of the movement, and as you start to warm up, what you'll notice is that you're able to get a little bit further each time. So Craig's going beautifully slow, nice and into it. If you think about the distance between your arm and your body, so we're increasing space between that armpit, that's the goal. He's going straight forward here across the table. You have something nice to slide on. If you need something at home, put like a towel or something underneath your hand and use your dining room table. And Craig's also using his entire body as he goes down, so he's not just reaching the arm and straining his neck or anything like that, but he's taking everything and going forward, so he's giving a nice flat back while he does it, which looks absolutely amazing. Okay, and as you come out of it, every time he's going in a little bit further. Perfect, and there shouldn't be any like popping, clicking, or catching in the shoulder. If you're having any painful clicks like that, then you definitely want to stop. You just want to go into that ease of restriction. Once you find a little spot that feels tight, hold it there.
Find that spot that's hot, hard, or tender. Allow the tissue to melt and stretch, and then slowly come out of it. And then on your next repetition, go back in, try to achieve the same range of motion, if not a little bit more. Find that spot that's hot, hard, or tender, hold it, and then come out of it again.
And I would say somewhere between 10 to 15 reps, but really what's important here is that you're doing it frequently throughout the day. Okay, so you don't want to just do one set in the morning and then be like, all right, that was good. Every couple of hours, 1 to 2 hours, it doesn't take a long time. Just maintain the mobility that you're getting here with the stretch by doing it frequently throughout the day.
The next exercise we're going to do is called a sleeper stretch. And here at Integrated Physical Therapy, we sell these myofascial release balls. They come 2 in the bag. And in this particular exercise, what we're going to do is we're going to remove one of them from the bag and we're going to use it in the back of our shoulder capsule, lying down on the table. So I'm going to place the ball on the floor or on a table, and I'm going to lie down so that ball hits right on that capsule. If you're on a massage table or a bed, it might be too soft, and you're not going to be able to get what you need to feel in that shoulder. This does not feel too comfortable, but it shouldn't feel too bad either. If it's too much, what you can do is place a towel over the ball to give yourself a little bit of comfort with that. Thank you for the pillow. So what are we gonna do next?
All right, so where Craig's got that ball position right now is a little uncomfortable, right? The pressure is pretty sensitive. You don't want to go to a point that's screaming. You want to find a point that's maybe talking, whispering, whatever you want to call it. But you can find a little bit above or below where the most sensitive spot is and then start from there. And now you'll see he's laying on the affected arm and he's got it at a 90-degree bend, meaning that that elbow is bent up towards the ceiling. And now he's going to use his other hand and almost act like a lever as he pulls that hand down towards the table. And I use the word pull, but I mean super gentle, okay? And see how slowly he's moving into that. And you should feel a stretch in like the back of the shoulder, okay? Once you feel that stretch, you're there, you're stretching. Are you feeling a little bit there?
Feel a nice good stretch.
Okay, we're gonna hold that there at least 30 seconds. You can do it up to a minute if you can tolerate it, and we're gonna go for 3 rounds. So as you start to hold, you're not forcing. His grip here is very gentle. There's no whitening of his knuckles. He's not forcing the arm down. Nothing's changing about his face. And this is just stretching out that posterior part of the capsule, which you need in order to get the mobility back after that frozen shoulder.
This is a wonderful stretch for all kinds of shoulder issues. We're showing it now for frozen shoulder. And another way we can do this is with a push and a pull. So in this case, my top hand is going to push down as my opposing hand, in this case my right, is providing some resistance. This is an eccentric. This will be much later on in the rehabilitation. An eccentric or contraction with elongation as it comes down. In this case, we don't hold the bottom. So then, in this case, my right hand pushes up while my top hand provides resistance. And again, we can do this 5, 7, 10 times, but doing it throughout the day. Every hour to 2 hours, create motion.
And if it's not practical to lay down on the floor, lay down on the table, you can get your body in the same position standing up against a wall. Looks very similar. If I was to go here, my body's in that same position, and now I'm just gonna take the arm and start to pull it down. So it's just as effective. With this one, you have a little bit more control, I think, because you don't have to worry about the rest of your body positioning. Your body's being held in the same place, just being on the table, and all you have to focus on is the shoulder.
And I don't have much of a shoulder issue going on right now, but I have noticed my shoulder rotation right now has increased significantly from the first couple repetitions we've just done here.
And so maybe you don't have a shoulder injury now, but if you didn't stretch out your capsule, you might have some impingement later on down the road. So this is something that's just good for the overall shoulder health. So we talked about that serratus muscle, which is the muscle that's responsible for holding your shoulder blade against your body. If you've ever noticed in boxers that look like they have kind of a second set of rib cage going on, that's what it is. And that muscle is super important for shoulder and scapular stability. So I've got Craig here lying on the table, nice and flat. There's a couple of different ways to do this. We're just gonna show you this one for now. And depending on the restriction in your shoulder is going to be how far up you're able to lift the hands. Ultimately, the goal would be straight up to the ceiling, but if you're not able to, then you can go anywhere from flat to ceiling and somewhere in between there, and you're going to try and get the arms all the way straight. Okay, and then the elbows are going to stay in this straightened position, and the reach movement is going to come from the shoulders. Good, so you're reaching up towards the ceiling and dropping back down. Notice how the movement is only coming from the shoulders. You can see the shoulders lifting up off the table and then slowly dropping back down. He's got good control. He's not letting the shoulders plop. And those fingertips are reaching. You're thinking about getting as long as you can. And those shoulder blades are literally moving around your body. So if you really focus on that movement, you're able to feel the shoulder blade coming around the side of your chest on both sides. And that feels okay for you there?
This feels great.
Again, maybe 10 to 15 repetitions. The most important part is that you're getting movement throughout the day, so I don't need you to sit and do a 30-minute routine, but I need you to split it up and do maybe 5 minutes multiple times throughout the day. And as he's reaching up, he's going to start to get a little bit more mobility here too, because initially you might be a little stuck or restricted. As it starts to free up, you're going to feel like you're reaching even higher towards the ceiling, and that's totally normal, and that's what we want in this case.
So thanks for tuning in for us and watching us describe what frozen shoulder is all about.
Yeah, and that was a pretty basic, just 3-step routine to kickstart the process. There's so much more that you can do, and we're going to be creating more videos with more content, more exercises to follow up with. That's a really good place to start in order to get your range of motion back.
And remember, these videos are just a little bit of a tidbit of information about what's going on in the process. It should never ever substitute the proper diagnosis and treatment of an injury, specifically one like this, a frozen shoulder. There's a lot more that goes into this with the manual work, the mobilization work, and how we bring in all the other body parts and how to get the shoulder to be stable throughout all kinds of movement.
But if you're thinking that you have that frozen shoulder and you try out some of these exercises, let us know how it worked for you. And if there's anything else you need to see, make sure to drop it in the comments below so that we can help you out with some more videos.
And do not forget to subscribe to our YouTube channel and hit that bell to make sure you receive the latest content that we release.
And thanks for watching, guys.
Have a great day. No? That work? So the next one we're going to do here is called a sleeper stretch. And here at myofascial release, I'm going to start that all over again.